Do you know if your favorite fruits could clash with your medications? Welcome to the Life Balance Guru. Today, we're diving into a topic that might just change your breakfast routine forever. In this video, we'll explore which drugs require you to avoid blueberries and why this seemingly harmless berry could be a problem for some. Then, let's get started. The blueberry bombshell. Blueberries are thought to be one of the healthiest foods available. They are rich in antioxidants, vitamins, and fiber. However, you may not be aware that they can affect some varieties of medicines. Individuals on medication need to understand these interactions since they will impact their health and response to the medication. Hence, let me ask, finally, what is it with blueberries? The fact is that they contain a lot of vitamin K, and they are causing changes in blood clotting. This can become a problem for those who are on certain medications, say anticoagulants for instance. Medications to watch out for. Anticoagulants. If you are a user of anticoagulant medications such as warfarin, maybe it's time to give that blueberry muffin a miss. Warfarin falls under the class of anticoagulants because it decreases the levels of vitamin K in the body, which is important for blood clotting. Blueberries contain vitamin K in abundance. Therefore, taking the fruit in large quantities negates the impacts of the medication, resulting in risk factors. Always ensure that you make consistent use of vitamin K if you are under warfarin. This means if you love taking blueberries, you can take them, but in a limited quantity. Antiplatelet drugs. Also, there are other classes of drugs known as antiplatelet drugs, for instance, clopidogrel. These medicines are taken to avoid the coagulation of blood cells, which may lead to the formation of blood clots, causing heart attacks and strokes. These elements in the blueberries may boost the impact of these drugs. In theory, this may sound like a benefit, but it increases the chances of bleeding. Did you know? One of the side effects is of course bleeding, and it is highly recommended to ask your doctor about your diet while you are on these drugs. Other medications affected by blueberries. Statins. Well, if you are on statins for cholesterol, blueberries are not your buddy. You better look elsewhere. These are drugs that help reduce cholesterol, and it is a fact that blueberries inhibit the metabolism of these drugs. This may lead to a high incidence of side effects on the body as compared to normal situations. Quick reminder, most of the changes that affect your diet should be done under the supervision of your doctor, especially if you're on statins. Certain antibiotics. Some of the interacting antibiotics include tetracycline, and this is where the consumption of blueberries poses a threat. Antibiotics containing calcium should not be mixed with blueberries because this fruit is high in calcium and will form a complex that cannot be absorbed by the body, therefore inactivating the antibiotic. The science behind the interactions. Therefore, what biochemical changes do you suppose to occur in your body when these two prescriptions are consumed together with blueberries? The interactions are mainly metabolic in the pathways of the liver. Interferences with the enzymes of this drug are capable of producing increased toxicity or diminished efficacy when blueberries are consumed. For example, the cytochrome P450 system that is involved in drug metabolism is affected by blueberries, which act as inhibitors for these enzymes, thereby changing the way drugs are metabolized before being eliminated from the body. This is why it's important never to hide any detail from your healthcare provider regarding your diet, especially when you frequently take large portions of blueberries. What should you do? If you are a user of any of the above-mentioned drugs, you are advised to see your doctor. They can advise you according to your special circumstances and standing. Remember, moderation is crucial. It does not mean that you cannot eat blueberries at all. Rather, they should be consumed in limited portions, and adherence to the intake time for medicines should be observed. Have you ever experienced any surprises with your medications and diet? Let us know in the comments below. If you found this information helpful, give us a thumbs up and don't forget to subscribe to Life Balance Guru for more health tips and insights. Thanks for watching.